Hello everyone, I'm Banya and I work with Welcome Trust DBT India Alliance, a public charity that funds research in biomedical and health sciences in India. Additionally, we work on initiatives that aim to enable, facilitate active engagement with science, and social media is definitely one of our favorite tools. So today, social media is a very powerful source of information, of connectivity and engagement among diverse audiences. And given the high rate at which social media platforms are being used, it is of, I think, increasing relevance to health research as well. Social media offers platforms for multi-directional communication with possibilities of communication, observation, research, and also engagement. In addition to these, social media has shown the initial signs of being an effective recruitment tool, especially in the setting of research focused on traditionally hard to reach population groups. So what we are trying to do through this webinar today is that we will try to bring you the nuts and bolts of using social media in health research. Our speakers, both of them, Charles and Alpana, through their experience, will help you better understand the potential of the medium, the different tools that can be used in the social media platforms, and critically think of challenges and role of ethics in using social media for research. So with that, I think we should dive straight into the webinar. Our first speaker is Charles Kamau, and I would like to invite him to talk to you about social media and how you can make it work for yourself. So Charles is enthusiastic about the nexus between science communication and public engagement. Charles has championed the use of social media as a tool of use among health researchers for identification of collaborations and also dissemination of outputs. So without much ado, let's welcome Charles to take us through the different tools that he uses as a science communicator and researcher.
Thank you very much, Banya, for the opportunity. Just to confirm that everyone can see my slides. Good. Yeah, my name is Charles. Like Banya has rightly introduced me, and I'll be talking to you about social media. And really, it's not to tell you anything that you already do not know, but it is rather for us to have a discussion as to whether you know what works best for you. Should you be in social media or should you be outside of social media as a researcher? I'm based in Kenya, in Cambridge, a PhD fellow, and I'll be telling you more about that. So just a brief background about myself is I started up my career in property management, then went in to do nursing, then went in to do junior fellowship as a researcher to try and look at blood transfusion medicine, which, like how they mentioned a bit later, was quite fundamental in the use of the work that will be presented today. I then switched into corporate communication and engagement, leading one of a collaborative capacity building program based in Africa, where sort of championed on how some of the almost 100 fellows can think about strategic engagement, and this is where also most of the work around social media started. I'm now currently engaged in the space occupied by the private sector towards UHC by 2030, and I'll come back to that. So let me just start by saying that Mark Walport is the one who put it best when he said that science is not finished until it is communicated. And this is also true for anything that you would want to sort of think about letting people know what you do, and also letting people be aware of what fronts or what excites you. But a lot has been said about communication. And let me add this particular point, say, so the presentation today is part of work that, part of a course that I have trained now to almost, close to 800 researchers now across several institutions in Africa and Asia. And and so I'll try and give bits and bobs, and so that you can allow more questions. And if you think about, so what you can see there is an arrow pointing downwards, and mostly this is how researchers normally see themselves. They see themselves as people who would want to start with a lot of background, look for supporting documents for them to actually come up with results and conclusions. But you look at the general public, the arrow is completely on the opposite side, where most people really start with results and conclusions. What is it that you're saying? And then for them to actually think, so what? Why should I care why this is happening before they even get to the background? And you see, the other thing is that most of them never really get to the point where they even think about background. And so this particular shift between the public and the research thinking is what begins to define why it is very important to communicate. And my angle now comes in to talk about why social media. Social media can be a lot, and a lot can be said about social media, but I want us to use this cartoon of sort of GIF. We're talking about for the lovers of coffee. Now, I'm not so sure how many of you here love coffee, but for the lovers of coffee, and if you're describing your love for coffee, if you're describing coffee across several platforms, social media platforms, on Facebook, you'll write and say, I like coffee. On Twitter, you like, I am drinking #coffee. And we'll come back to why it's important to do hashtag, because that's what helps you to curate your work. On Instagram, you'll be thinking about, here's a vintage photograph of my coffee. On LinkedIn, you'll be thinking about writing, my coffee drinking skills have been endorsed. And YouTube, is a video of me taking coffee. And in Snapchat, for those who are young at heart, this coffee will serve to destruct in about 2 seconds. So what I'm trying to show here is that there is no single message that can go across all social media platforms. So it's good for you to understand which one am I in or which one do I want, because the context and the message that you're going to pass there is definitely very different. And most people really go ahead and ask me, so why should I actually be on social media? And the thing is, number one, I always say that you're already in it. You're already a social structure, you're a social being, and being in spaces where you can actually have a conversation with people, that is form of social media. The other thing is that you're also there to make connections. You're there to find people who have interests that you share. The other thing is that you're there to exchange scientific ideas. The other thing is that you're being a reputable source for your work. And let me just dwell a bit more and say that the work that you do, you're the one who bears the most vision about it, the most you have the best understanding of what you do. And if someone ends up, and I think this is a situation that happens somewhere where someone was trying to engage them in trying to understand the importance of social media, said, I don't need it because the people that I meet are not on social media. And it was a senior researcher who had actually gone to a conference, and someone just tweeted what he said, but taking it out of context. And so so I was trying to tell them that because you are not there, because you're not on social media to correct it, then that means you're not a reputable source. The other thing is that you are doing that to advance your career. I mean, I can't belabor the point more, because we all want to advance our careers, and you're looking for an outlet in which this can actually happen. The other thing, which is I'll speak about towards the end, is you're building your own personal brand. You want to be consistent. You want people to know that these are the things that you believe in. You want people to know that this is exactly what is important for you. And just purely put, you're also thinking about cutting out the middleman. You want to be the person who is now seriously engaging with your work, and you're there to respond, because at the end of that handle, at the end of that Facebook account, at the end of that LinkedIn account, there is a person. So you want to be the person who is engaging with whatever. And even if for nothing else, if you look at what happens in 60 seconds online, about 87,000 people are tweeting, about 500,000 tweets have been sent in, about so many emails, WhatsApp messages, Facebook Messenger. There's a lot that is going on, and so just being out of it it's not really, you're not increasing the impact of your work. Quickly, with the three things that I normally see as overarching when you're using social media: one, you're there to collect assets. You're there to look at what is important for you, and you can collect it. The other thing is that you're there to find people with mutual interest. And the other thing, you're there to generate new content, which and if I push this further and say, sometimes most people will talk about things that are not factual, but because you're not there to create factual content, then you're missing out. And rightly put, or frankly put, you're denying people the knowledge that you already have, and they are, they continue to get more and more facts that are not right. Again, very quickly to talk about, is it really worth it? Some people ask, is it really worth it? What's the return on investment for social media? And for this, I'll just use very personal examples and things that I've seen work most recently. The thing is it worth it? Yes, because it can be used to spark debate and engagement while you're slowly building your own audience. And a quick example is this tweet that was actually tweeted yesterday by one of Kenya's journalists, and he says, Kenyan / African scientists on Twitter, please talk with me. I'll quote, says, a new study based on autopsy reports on individuals with HIV finds that people live longer and that they die of other complications from having the infection. I just took this as at yesterday, but we could actually even start seeing a lot of researchers who are saying, if you're talking about this one with HIV positive New York, and what you can begin to see is that people already know what you're talking about and they are there to help you. And probably this is just happening when everyone is behind their desks and everyone is in front of their mobile phones or in front of their television, and they're really happy to give you the information. This is what I'm calling creating a community. And you see, like, for example, this tweet says, I know 2 researchers in Kenya who conducted such a study. We can talk about this offline. And, of course, let me DM you. And so what I'm trying to say is that there is an opportunity for you to spark debate and engagement in an area that you're really interested in. The other thing that another quick thing is it's a free place for you to build your own brand, the you that you think you are, the person that you think you really are, rightly put, that you are a brand. I'll show you quite a number of people who really excite me on Twitter, for example. One of them is one of Africa's, arguably internationally acknowledged journalist, Larry Madowo. He is a brand and he creates a lot of hype around the work he does. He's a bit witty when he does it. And he can actually bring in the human side of always. The other person is Phaedos here again, who is someone who is a renowned researcher, a renowned immunologist, and is actively engaging with more and more people and actively being there to talk about about her science. Another thing is, for this, you should always aim to bring out your strong side. As you're creating a brand, you want to bring out your strong side. Of course, we all have weaknesses, but you want to bring out your strong side for people to start engaging with you. This is what we see before we get to you. So by the time I look at your profile, this is what I will see before I actually even get to you. And the other thing is that you should always aim not to oversell yourself. You remain truthful and you remain real. And you also always constantly remember the social media. We do not want, and like I keep on saying, is that we all know that some heads of state do not tweet on their behalf. People are employed to tweet on behalf, and sometimes when you look at it, you sort of feel you lack the personal touch. But for this particular, for a case where you are in charge of what you're doing because you want to build your own brand, then you should always remember to keep the social. Again, just a quick, another few highlights of people. Michael Chu, one of my favorite people on social media, and I think what I want to bring out is you should always put in an introduction, a bio to the to your page. People should know what you do, what you believe in, and why they should follow you. Another example is Evelyn Gitao, who is looking a change agent in the development of science and innovation, and you should always talk to her about immunology, capacity strengthening, and science advocacy. Again, Sarah, who is organizing for this, again, talking about enabling science communication and engagement. You love music and cinema, and again, this is what I'm talking about, being social, bringing the social bit. And yours truly, myself, can always talk to me about the intersections of design thinking, PR, and UHC by 2030. And these are some of the things that you want people to know you do. One of my very favorite people on Twitter is the co-chair of the UHC, by 2030. And what he says is, and this is what I'm also bringing the social bit again, always feel free to throw in some of these selfies, always feel free to show your, your sort of your other side other than just the science that you do. Just quickly brush through this, looking at my social media message, what and how should I craft it, and maybe some very quick things is one, you should always aim to grab attention. And if you're thinking about grabbing attention, you're thinking using pictures, you're thinking about using numbers, you're thinking about remaining positive, and you use a conversational message, something that aims to bring out engagement. You should always think about timing is very, very, very key. Looking at what time am I going to put up my post? Is it the right sort of global time? And I remember this a friend of mine who is a diplomat, and we once met on the airport, and we decided to take a selfie, but we couldn't really upload it because around that time Kenya had just had some attacks, some terror attacks, and it wasn't really going to be the right time for you to celebrate on how you're having fun. So again, timing is very key because you're also thinking about your own brand. Know the right platform. Sometimes Facebook, think about, do I want Facebook, do I want Twitter, do I want LinkedIn, do I want YouTube, and how can I integrate all of them? Know your audience, that's very important. Know who you want to talk to and know exactly what you want to tell them. The other thing is that you should always stay on top of your work, and always stay on top of the kind of things that you want to say. Having said that, you should also really, really be careful about overindulging, and I'll talk about that in a few. I think lastly, even as I bring this to a close, just some of the hacks that I think have worked for me. Number one, what do you want to get from social media? Define your audience, define your purpose. Do you want to talk about your work? Do you want to engage? Do you want to know what people are saying? I have quite a number of people who tell me, Charles, I only want to be on social media so that I can know what is happening, so I don't want to be out. So it's good for you to draw those boundaries and sort of engage, and as you slowly now become more and more interested in it. The other thing is that do not overindulge. Create a brand yourself. Think about what is that consistent message, and I do not want to overindulge. The other thing is increasingly people are having what you call the fear of missing out. So you do not, it's a river, it's a stream. Trust me, there are things that are going to pass you, and if they come back to you, then that's good. The other thing is that you should always attract what you want, filter a lot of noise. Again, when people tell me, I just want to know what's going on in malaria, but then I saw someone has bought a new dog, another person has flying or whatever. So you should always, sort of filter all the noise for you to get it impactful. There's no emergency for social media. You shouldn't always feel, oh my goodness, I need to be on social media now. And you should always plan yourself and engage, and feel free to, and feel free to sort of step back. You shouldn't always feel like I really need to talk about this. It's okay for you to feel free to step back. And I think some of the other things that are increasingly becoming important is the fact that social media is trying to change the trends that are going on these days. Just today, The Guardian just reported that Facebook has chosen to direct vaccine searches to public health pages. And on his part, the WHO Director General said that this is a very good commitment, and it just says that people are now going to get more reliable information about vaccine. We all know some of the trends that have been going on about vaccine hesitance. So again, social media is trying to get into it. And so as I bring this to a close, my general thinking is that, well, researchers, we have so many avenues to present our work. We have so many avenues in which we want to talk to our work. But I see the unique opportunity, because if you look at all these people, it's very difficult for you to notice this guy, the guy I'm pointing at. But with social media, it is very easy. It is very easy for you to be found, because it is your own stage. You are the one who is in charge of your own stage, and you're the one who is in charge of what is happening to you. Thank you very much for your attention.
Hello, Devi.
Hi, Charles. Thanks for this. Hi, Charles. Thanks for this wonderful and insightful thing.
Charles.
Yes, I can hear you.
Yeah, right. Thanks, Charles, for this insightful overview. I would now like to participants, if you have any questions, maybe request you to please use the question box to post them, and we will take the questions towards the end. Uh, I would now like to invite Alpana. Alpana works as a consultant research director with Humsafar Trust. Alpana is a social researcher with over 2 decades of experience in studying and linking the clinical data to behavioral data to inform more about the progression of HIV/AIDS epidemic among the MSM population. At Humsafar Trust, she has led multiple studies on the LGBTQ community that help bring the voices of the community to the mainstream through research and help strengthen strategic planning and influence policy frameworks. Alpana is going to speak more about how research can be done through social media. Over to you, Alpana.
Yeah, thank you, Devi. Thank you, Devi and Banya, for this opportunity. And namaste and jumbo to everyone, all the brothers and sisters who have joined in this webinar. I'm very happy to be here. And I'd like to share some of my experiences of past 2 decades. So basically, leveraging social media for health research, and I'm going to be talking about focusing on hard to reach communities, especially men having sex with men and transgender persons, which includes transgender women and transgender men. So basically, how did we get here? How did we come to the social media, to recruit our participants and utilize social media for our research? So just to give you a little bit of history about this. So I started working as a consultant for the Humsafar Trust way back in year 2000, when the first targeted intervention program, which was supported by the National AIDS Control Organization of India, had just kind of got on the ground. And we needed to do the first knowledge, attitude, behavior, and practice study in the year 2000. That is where we had gone on the physical side, you know. So basically, all the sites where MSM gathered, socialized, groups and had sex were mapped, and that is where the outreach workers were going and talking to them about the behavior change communication, about the utilizing condoms, prevent HIV/AIDS, and also disseminating correct information on HIV prevention as well as. So that is actually the beginning of research as far as the MSM sector is concerned. Now, that was the physical space, and that is where we went year after year. So basically, every 18 months cycle, we used to go and collect information about MSM, knowledge, attitude, behavior, and practices. What happened at that point of time was internet. I'm sure some of you must be like in your elementary school. At that point of time, internet was still at a very, not at a very mature level the way we see it now. Obviously, I'm talking about nearly 2 decades back, and you had chat rooms. So slowly people were kind of engaging with people in the chat rooms, and we had started collecting data. How do you meet people? And one of the answers that we did in year 2008, a few answers, was chat room. Okay. And I think from chat room, the progression happened towards Planet Romeo. And, then the dating apps came in the picture. So now we have two world which is existing. The one which is on the site, where in public sites, people are actually going and seeking partners, meeting partners. And then you have this virtual world, which is, you see, one is dating apps, which is the location based apps like Grinder, Scruff, Tinder, Blued, Hornet, Planet Romeo. So Planet Romeo was the earliest one, then followed by Grinder. So Grinder broke out big time in India somewhere, around 2012. And social media platforms like Facebook, where people actually had these groups which used to be, like people who are LGBTQ, people who are gay, they want to kind of communicate information about parties, sex groups, partners, seeking partners, friends. Those were the groups. And then last 5 years, it is instant messaging platforms, WhatsApp, Line, IMO. I think we also have WeChat. So these are the platforms where our populations are existing. And you would think that there could be an overlap. Yes, there could be an overlap between the offsite and on-site population. So basically, offsite are the ones who are operating on the social medias through, like on internet, basically through dating apps, social media, and instant messaging, and the ones who are on the ground looking for partners. Yeah. Okay. So this is the world that we have currently, and we realize that okay, now there are people. They were, you see, in India at that point of time until last year, homosexuality was criminalized. So there was a lot of backlash that was socially experienced by men who were on the physical sites, and there were also hassles experienced by the extortionists, the goons, sometimes the policemen, by the gay men who were cruising on these public sites. Obviously, the social media provided a very, very safer platform for people to find partners, to connect with them. So it considerably reduced the risk which existed on the offline platforms. Now, what do we do? What do we researchers do? We evolve. We evolve looking at what kind of populations that we have, what are the new research domains that are existing. So I'm just running this quickly for your knowledge that when we say researching internet populations, these are the things that we need to kind of, look into. Like, for example, we say for example, I'll give you an example for the first point, which is we have a secret chat group, okay, where people do not identify themselves, but they're talking about the issue. So if you take that and analyze qualitatively the conversation, that you are actually harvesting and mining that data, so that is one type. The other is that research that uses internet as a vehicle for recruitment or interaction, directly or indirectly. We have done that. We have given advertisements on different platforms, on WhatsApp groups, we have given it on Grinder. So internet has become a vehicle for us to recruit as well as to interact. Then the point is research about internet itself and its effect. So patterns or effects of social media, search engines. Right now, we have used for some intervention studies, communication studies, where we have sent out messages regarding testing, HIV testing, either on WhatsApp or on emails. Next one, please, the slide. Yeah. Then also research about internet users, what they do, how the internet affects individuals and their behavior. So more than, so basically we are looking at dating apps. What is the kind of profiling people have? What kind of picture they put? Are they sharing their prep usage? Are they putting their preference about what kind of partners they are looking for? So that is again in their internet users, but they are actually MSM internet users who are on the dating apps. Then research that utilizes Inter as an intervention tool. Yes, we have delivered a communication intervention through internet, and then there is a lot of data that we have collected, which is pan India data, because we know that we want to get information from a huge country like India, different states, and we really, so there is a study on LGBTQ bullying and experiences at the educational institutions that is also collected in a pan India survey. So, and even the recruitment. So everything that you see in these two slides, that is the umbrella term for internet research, is what we have already done. So this is what research is for us. And yes, so what we are saying, like I said earlier, that we identified that there is an offsite, that is in the physical spaces research domain existing, and there are size estimations to that effect, and then there is a virtual population, and there could be an overlap unless you actually contact dating apps individually, which is Grinder or Planet Romeo or you Scruff or any of these sites. You wouldn't know any of these apps. You wouldn't know what is the actual size of people who are on these sites. So that data I do not have, but we have other physical size estimation. So we have these two domains, and we try to see that we do the justice in terms of generating evidence on both of these, from both of these domains. So this is where, as far as researching internet population is concerned, we can go on to the next slide. Yeah. Yeah. So yeah. No, I think there's a one. You just skipped one. There's one more. Oh, yeah. One more before. Yeah. So, like I was talking about the research, this has been the research that we have done. We have mapped communities, their understanding of the platforms, their usage, their different groups, Facebook, WhatsApp, the influencers, risk assessment and behavior of users on different platforms, acceptability and feasibility, which is the cross-sectional service, and message-based studies, linkage to testing and care models. The next one, please. Yeah. So one of the questions that had come was, what are the research ethics for research on social media? I think we have to be as responsible for the social media, research that you are conducting on social media. The rules remain the same; they don't change actually. It's called the respect for persons, beneficence, and justice. Respect for persons, it means that, a person has a right to know what this research is all about, why he or she is participating in the research, and, have the right to have the consent, confidentiality, and being able to, and that basically that freedom that I can leave this survey without any repercussions, the same principles that you would use when you do a research based on pen and paper. Beneficence. Basically, this research should not be harmful. Same principle applies for research for the social media populations. And justice. Okay, justice is, am I being selective in recruiting participants, or everyone has an equal chance of being included as the participant as long as they meet the eligibility criteria. So this is the principle of justice. So basically we are following all these three principles. Confidentiality and consent is a topmost priority, and research proposals are rigorously evaluated by the Institutional Review Board of the Humsafar Trust. So let me just speak after the consent, after the research ethics. The next slide, please. Yeah. So what are the policy guidelines for our research? So the Humsafar Trust research is guided by the Institutional Review Board of the Humsafar Trust, and the IRB policy, whatever IRB members, they utilize the IRB policy. It also weighs all research, including research that is to be done with the the internet population. Humsafar Trust research policy is very clear on the ethics to be followed, the technicalities to be followed that is applicable for research on internet populations as well. And there is a Humsafar Trust child protection policy that effectively prohibits people below 18 years of age being part of any research because you require parental consent. And the most important is that the law of the land. So we have Indian Information Technology Act of year 2000, the rules of which are applicable for our research also. So these are the four guidelines that we follow for conducting our research. Next one, please. Yeah. Now, management of participant and client confidentiality. I think this is extremely, extremely important. Recently I saw this documentary on Netflix called The Hack, and talked about how Google or Facebook or all these, apps and websites are harvesting, utilizing, and mining data, which we one very innocently, unwittingly give away while surfing the net or, just answering a few questions. And I think in the light of this, it has become even more important that, client confidentiality should be followed to the maximum. So all the researchers, investigators have undergone NIH ethics training, research ethics training of the organization, and are thoroughly bound by this. So now you would ask me, well, when I'm writing, I'm filling a questionnaire, I have an IP address which is automatically available. So what do you do with that? So I do not deny that the IP addresses are not available. However, it's only used to exclude when India is an inclusion criteria. We do not require IP address of our participant to track the participant because that would be illegal under the Indian IT Act. We only collect IP address just to remove people who are not eligible to be a part of this survey. After excluding non-Indian population, we destroyed the data immediately, absolutely then and there only. There is no record of it whatsoever. If at all there is any personal data, which is email/mobile number, because when you do an intervention study where you are sending messages, a person has consented to participate in this online study where a person is exposed to communication messages, that person definitely shares either a mobile number or an email address. And then what do? So basically, when we have this kind of information, the data is segregated, it is de-identified and then analyzed. And when you have information, it is held by one responsible researcher, and it is held in full confidentiality with no one else having an access to it. In fact, I'll give you an example. I've been a principal investigator on many studies. I have no access because the person who's responsible for sharing that particular communication with the participant is absolutely separate and is under oath not to reveal this to me, who is he sending this particular communication with, to. So I have absolutely, I'm a principal investigator, I know what is going on largely, but when it comes to, so it's like, hello, knock knock, can I come in? No ma'am, you can't come inside because I'm sending communication messages. It is that level of confidentiality that you need to maintain. And why we are able to do it? Because all our researchers and investigators have undergone research ethics training and they know what to do. And we have a very vigilant IRB coordinator. So the IRB coordinator is sitting in the office and is like, has eyes and ears everywhere. So any violation, so we are very conscious that we are being watched and monitored so that no ethics can be compromised as far as research participants are concerned. Next slide, please. Yeah, our IRB, it is like extremely vigilant and very particular IRB. And before I go to this slide, I would really like to talk about the Institutional Review Board. Now, this Institutional Review Board of Humsafar Trust is having 4 women, 2 men, actually 3 men. Out of 3 men, 2 men belong to the community. Out of 4 women, 2 are doctors, and 1 person is a lawyer, and the other person is a counselor and person who works with the program management. So when we were doing a study on people who were on Grindr to test their knowledge on PrEP and also understand their testing behavior, so we had a presentation. So we created an IRB presentation. Now you look at this group of people where you have 4 women and 1 straight man, 5 people, and 2 men who have some idea about the dating apps. So how do you do? Are you going to blindside them and just make a presentation? No, you're not going to do that. So what we did was, we actually asked them to download Grindr on their mobile phone. And then we had 1 active person, as a person who had already had Grindr, we asked him to explain that how Grindr works. Okay. So actually 4 women, because they are 4 straight women, they have no idea about a gay dating app like Grindr. So they actually had an insight about how the dating app works. Mind you, I'm sure some of you are millennials and you're like really wondering that, oh, how is it that you people don't know dating apps? But I have people who are like, 50 plus people, some of them, they have never been on any dating apps, and some of us, people like me, we have completely missed the bus of dating apps. Okay, so we had to actually give them the exposure of what the dating apps look like. So let me tell you, our IRB is so smart, but just by going through that 15 minutes of what you call demonstration of a dating app, they figured it all out, especially the privacy and the confidentiality related issues. So the first thing they asked, we do not want to discriminate between the offline guys and the online guys when it comes to paying compensation. So what are you going to do as far the compensation is concerned? So here are my answers. Cash for participants recruited online, but research taking place offline. So such a person came, contacted, because he saw an advertisement on one of these internet ads or WhatsApp messages, or some chat room, and offered to be a participant, fell in the criteria. So we will give cash, what we would normally do. Then the second thing is automatic download, coupon download. Now my participants are not meeting me. I have circulated this questionnaire. So how do I compensate them? Automatic coupon download, So no personal information is required. You finish that questionnaire. At the end, when you say submit, automatically you are becoming eligible for receiving that coupon download. This coupon would typically be an Amazon voucher. In case of pan-India large-scale surveys, Raffles are announced. Mind you, it was like an open survey for, we had kept the survey open for about 4 months, and we decided that we had requested IRB that it's really a large-scale survey. The current budget does not fit into, providing compensation to each and every person, and they're all over the country. So we have a limitation with the budget. We will give free information, whatever information access they require pertaining to their health or any issues as far as the organization is concerned. But we have about 300 coupons that we'd like to give as raffles. Fortunately, the IRB agreed, so raffles are announced. However, participants have to say whether they want to share their email, so that the raffles, if they win a raffle, it can be sent. So typically out of 5,000, about 500 or less than 500 people would say that they would like to share the email address, and then the raffle is conducted. After that, all the details are deleted permanently. We also seek email in case if people want information about the research, but we actually tell them, look, this information is going to be available on our website from this day to this day. You can access it at this point of time, so disseminating information that has emerged from the research for dissemination purposes. So that is the method that we use for dissemination. Now there is one point that I had got about research. When you are conducting research, what are the things that you have to keep it in mind? We have to remember that this is the era of quick is good. Now you're really precariously placed between people's fading attention span versus the kind of questions you have to ask. We have done some disastrous questionnaires, let me tell you, and you learn from your experience. So the first study that we did, the questionnaire went on for like about 45 minutes. We were not mature. In fact, when the pilot we were doing, like we told a couple of people in our office to just take that sample test, and people literally wanted to come and give us a slap saying that 45 minutes, are you kidding me? I'm sitting 45 minutes in front of this PC filling up this questionnaire. Do better than that. And trust me, we become smarter. So respecting people's time and the attention span, we keep questionnaire as crisp as possible. I think, but the range of questions that you need to ask, it almost touches 15 minutes. Okay, so from 45 to 15 minutes, it's not bad at all. Yeah, 15 minutes it will require you to fill up that questionnaire, max. That is maximum. Okay. Then you use SurveyMonkey or Lime Survey, or different online surveys that are available. Be very careful about the skip logic. Okay, I have been going through something because my researcher had not put, she and I had an argument, and she said, I'm not going to put the skip logic because it is preventing a person's freedom to go through the entire questionnaire. If you stop here, it's not going to help that person. That person still might want to so I had to then rework the questionnaire. We had to work the questionnaire, and we did not put the skip logic. So my ends, they become a bit messed up. So wherever there was a logic in the skip that had to be put in, but like, so skip is like, unless you answer this questionnaire, my arrow is stuck there, you can't go to the next one. That we removed in order to give more freedom to the participant, but that's a call a researcher has to take. Then also surveys, so sampling. Sampling is, most of our surveys have been non-probability sampling. So we have gone for quota sampling, convenience sampling, and snowball. So snowball has been pretty much on WhatsApp. Can you share this survey link, to someone, who's from the community? And then the questionnaire takes care of it. It takes care of the consent. It takes care of the inclusion criteria. Okay. And also we have done convenience sampling. So convenience was looked at it this way. I have this questionnaire in the public domain. My survey is on for 4 weeks, during which I'm promoting it on social media, through different platforms. And it is on from 1st to 31st. And 31st, I shut my survey. That is one. And second thing is, I have worked out a sample size of 377. My survey is on, not exceeding for 6 weeks. I get my 377 sample size and I shut my survey. So this has been the sampling. And yes, yeah. So I will connect it back to what Charles had talked about social media. He had talked about, what impressed me was he had talked about collect, community, and create. So here is the thing. So collect, what are our assets? All the social media platforms, where our populations are our assets. What is our community? Our community are the people who are using, these are the users who have a very rich social media life, though I'm very poor as far as my social media habits are concerned, but I'm very respectful of people, Charles, who are able to engage and continue, having that thread going on, discussions, keeping discussions alive. So this is the community which is on different social media platforms. And what are we creating out of this social media platform? We are generating evidence, creating scientific knowledge as far as the social media is concerned. Yes, so collect, community, and create. Linkage from what Charles said to what we are doing, trying to do here as researchers. Can we have the next slide, please? Yeah. So if you're really looking at details of, ethics that need to be followed for the social media, so you have social networking and ethics as the, resources. It is available online, the Stanford Encyclopedia of Philosophy. It will really, really help you, in terms of understanding the changes that are happening and what are the other good practices that you're going to adopt. Talking about the good practices, I want to share one incident where someone who got, who was not eligible for a survey because he was below 18 years of age. He found out an address from the online from website, and wrote an email to one of our colleagues that you people are being extremely discriminatory by not including people below 18 years of age. Your survey threw me out. This was one example. Another example is someone walked into the drop-in center and he said that I have filled this survey online and I thought I might want to visit you. And actually the person who was attending, that person was a researcher who had uploaded that survey. So that person said, well, we have so many studies going on. You don't have to really, you can seek services irrespective of, whether you are filling up a particular survey or not. So actually, this is the kind of confidentiality that gives confidence to our participants that they can take this survey. Now, talking about biases, things like biases and all, in my experience, I don't think that people's time is precious. I certainly do not underestimate people's, commitment to what they want to do with this survey questionnaire. When I am not seen, when I'm not heard, when I'm not sitting in front of this person, the person doesn't have to, is not under any pressure to give any socially desirable response. But if there is a possibility of some kind of bias, we cannot rule out, because that possibility would always be there, no matter how hard we try. But I'd like to believe that since I'm not there, the person is not under any social pressure to please me, so that is as far as the biases, social biases are concerned. And let me see what more points are there. Okay, so I'd like to talk about the four kinds of study. One is IshConnect, that talked about the HIV related risk behaviors. Then there is a study called Chalo, which was a randomized control trial. We had created a whole lot of communication messages and two arms, which was receiving two different kinds of communication for testing. It was delivered online through WhatsApp and through emails. The third was a Grinder study. So Grinder and Humsafar Trust partnered, and Grinder ran the survey link and advertisements to fill the survey. And the study is called the 0 meters away, and it was on testing and prep. And the fourth is swag. So it is about how people are presenting their dating profile. There could be one question on, okay, if so many MSM are there, what about transgender people, especially transgender women? So I completely agree. As far as the difference that is there in terms of social media usage, in another study, we found that transgender women were much more comfortable with WhatsApp more than the dating apps. You have some percentage of transgender women on dating apps, but we try to see that we maintain the online offline ratio. If we feel that we are not going to get sample online of TG women, then we actually go to our offline domains and collect the data. The whole idea here is that people should be represented the way they deserve to be represented. And that's where I think I have covered most of the points. Yeah, the next slide.
Thank you so much, Alpana. This was really insightful. Thank you for sharing your experiences, particularly working with the LGBTQ community and the rich knowledge that has come from there. I'm quite sure that these experiences and the other issues that you've spoken about in using social media for research is applicable across various fields. We will now open the floor for questions.